Let's show our viewers this 3D image, and I think it kind of explains the shoulder and the anatomy. So, Edward, if we can have you walk over there and tell us a little bit about how the shoulder is made up and what are the main components that make up the shoulder.
Thank you, Olga. So if you see here, we have a basic layout of the shoulder anatomy. Obviously, we don't have a lot of soft tissue displayed over this model. Basically, it's just bone, and all this white type of material here is the actual ligamentous tissue that is involved in the shoulder complex. Obviously, one of the interesting things about the shoulder is that the shoulder has a lot of freedom of movement. So there's a lot of different planes of movement involved in the shoulder. So one of the things inherently about the shoulder complex is that it's a very kind of unstable type joint. So soft tissue plays a big factor, muscles, tendons, in giving stability to the shoulder. Obviously, just to cover a couple of the basic landmarks of the shoulder complex, here we have the humerus, and then the ball of the humerus here, which connects into part of the shoulder blade, into an area called the glenoid, and that basically is what makes up the main shoulder joint area. Obviously, here we have the clavicle, and then here we see a kind of a hooking type bone formation, and that is also called your acromion. This is also known as your AC joint, and we'll be going over some of the injuries involved. Obviously, underneath this area here and surrounding this entire area is your rotator cuff tendons, which is something that's very common these days with injuries and things like that. So we'll be going over a lot of that different type of material here today in the show.
And Edward, using that image, can you tell us exactly what is tendonitis? Because I hear that a lot.
So tendonitis, this is not the best model to kind of display that, but just to give you a basic kind of idea, in this area here that's going to be surrounded by muscles, basically tendonitis is inflammation of the actual tendon. Tendon is the portion of the muscle as it reaches the bone. So that's what connects the muscle into the bone area, and that area is called tendon. And the reason that there's a lot of injuries with that, and tendonitis is so prevalent. Usually one of the main reasons is overuse injuries, and we'll get into that a little bit later. That area, as it connects into the bone, is almost avascular, meaning it doesn't have a rich blood supply. And if it does not have a rich blood supply, it's going to tend to heal slower and have a big propensity to become injured and irritated.